webinar where we are talking about issues around opportunities and support for adults with learning disabilities in Scotland. So we're going to record this first half of the webinar, where we'll be hearing from Rob and our colleagues here from PAMIS, and then we'll turn the camera off to have a proper discussion once we've been through that. So we know the lives of unpaid carers are busy ones, so we wanted to record it just so we can share it with people who couldn't make it this afternoon. So for those of you who don't know me, my name is Emma Congreve. I'm an economist here at the Fraser of Allender Institute, and we're based at the University of Strathclyde. So we're an independent research institute that does a range of analysis on public policy issues. So we cover kind of the wider economy, right down to issues around, how different parts of policy affect people's lives. And we've been really enjoying the work we've been doing over the last year on adults with learning disabilities. It has given us so much to think about and to look into and to research and to talk about. And we've had some great involvement from research participants as well, some of you who will be joining us today. So thank you so much for making our work possible. So the analysis we're talking about today is from a report that we've just published, looking at the economic value of unpaid care. So this is a topic close to many people's hearts, we know. So what we tried to do in this analysis is to gather information on the amount of time that unpaid carers spend on caring for their loved ones, and to try and put an economic value on that, because often it's economic values that kind of get the attention of politicians and government, although we know there's no way you can actually put a proper financial value on the care that people give and receive. So we've had a look at some methodologies for doing that, just to give a flavour for those interested in this in the public policy domain of the enormous value that unpaid carers bring to the economy and save the public purse. On top of that, we've had a look at some of the issues around family finances, because we know that households with a person with a disability are at high risk of poverty, and that's only been borne out in our survey and results. And we also looked at some of the issues around well-being for carers. So in a moment, I'm going to hand over to my colleague Rob, who's going to talk through those in more detail. Later, we're delighted to be joined by Jenny Miller and Pat Graham from PAMIS. So PAMIS is promoting a more inclusive society, and it's a Scottish charity that supports people with profound and multiple learning disabilities and their families. So we really look forward to hearing from you later. We've also got a wee video to show you that we put together for this piece of research, which we'll show you at the end of this first half. And at the end, we'll open up to discussion. And as always, participation is totally voluntary, but we really hope to gather some of your insights so that we can reflect on those and write them up, and then take them to ministers and civil servants and health and social care professionals that we know and have got to know over the past year, to really make sure that they're hearing the voices from you guys. So without further ado, I'm going to pass straight over to Rob, who's going to share his screen with a few slides and talk through some of the research.
Hello everyone, thank you Emma. And thank you to everyone for coming today. So it's good to see so much interest in this work. So as Emma said, I'm going to talk you through our research, our findings, how we calculated them, and I'll also touch on some of the implications of our findings, and then hand over to Jenny and Pat from PAMIS. So this piece of work, it adds to the evidence base on the extent of support that unpaid carers provide to adults with learning disabilities, the economic value of this support, the impact on family finances and carers' well-being. We surveyed a sample of unpaid carers of adults with learning disabilities in Scotland to find out how they spend their time on as close to an average day as possible. More information about their financial situation, and to assess their well-being in comparison with national averages. We also conducted a focus group, which we need to thank Enable Scotland for organising. And we profiled a case study of an unpaid carer's experience over the last year or so, just to bring to life the data and the numbers. So it's quite a rich source of data, both quantitative and qualitative, that we were able to draw on. So I'm going to share my screen now as we go into some details. Right, so hopefully you guys can see. That's better. Okay. So first of all, I just want to touch on why all of this matters and why we wanted to do this specific piece of research. So firstly, and obviously the most important reason, is that it matters to people with learning disabilities and their families, what we're talking about today. We're talking about how people are supported to live their lives, to live independently as possible, to have opportunities to live rich and fulfilling lives, and the support that enables them to do that. But it also ties in with the Scottish Government's economic priorities around building a wellbeing economy and delivering inclusive growth. It tells us something about the kind of economy and society that we have. The timing of this matters as well. I guess we're not out of the woods yet with COVID, but with the vaccine rollout continuing, we are beginning to turn our attention to how we recover and what we recover to. We know that unpaid carers have filled in the gaps left by the care system over the last 18 months. And obviously it's been difficult for everyone, but I think it's hard to ignore the significant and potentially long-term impact that all of this has had on people with learning disabilities and unpaid carers. With that in mind, social care reform is on the agenda, and the social care system clearly comes into all of this. Another thing is, it's actually quite a fairly under-researched area. So we're applying economic analysis to care and support that isn't provided for money. So it's a little bit more complicated for economists to measure the value of this in the same way that we measure other activities. So, as I said, we hope that this can add to the evidence base around that. We have a focus on learning disabilities, and sometimes people ask us why are we focused on unpaid carers of adults with learning disabilities specifically for this piece of work. Obviously, a lot of what we'll talk about applies to all unpaid carers. But we focused it on unpaid carers of people with learning disabilities specifically, partly because it fits into a wider programme of work on learning disabilities that we're doing at the Institute that Emma touched on at the start of the webinar, but also because learning disabilities are by definition lifelong, and the fact that it's often parents who provide the unpaid care, even as their child becomes an adult, it means that the nature of caring responsibilities and the impact that it can have on your life can differ from other unpaid caring roles, such as caring for an elderly relative. So when we're thinking about how to better support unpaid carers, it is worth noting that they're not a homogeneous group. We need to consider the interaction between caring roles, finances, and well-being in a way that reflects these differences. So that's why we focused this piece of research on unpaid carers of adults with learning disabilities specifically. So we sent a survey to a sample of unpaid carers, and they reported a variety of different caring activities. And for this research, we broke it down into three main categories. The first one, personal care, for example, help washing and dressing, food preparation and support eating meals, assistance with mobility, providing medications, help with therapy exercises. Second category that we saw was other essential caring activities at home. So our sample of unpaid carers were reporting things like supervising their family member, ensuring safeguarding at home, taking part in things like art classes, managing and organising their care, liaising with staff, health and social care staff, transport and attendance at medical appointments, And all of this stuff is not to be overlooked. And then the third category that we drew out of the surveys we got back from our unpaid carers was additional unpaid care for those in supported accommodation. So this is people that don't live with the person that they care for. What you see is that unpaid care, it reduces but doesn't stop. Examples of this include getting in the food shopping, responding to overnight emergencies, various other activities that ensure the loved one's well-being. So this is all taken from what we had back from our sample. So I guess the point of showing this slide is to illustrate that the role of unpaid carers might differ from what people expect, that it's not all just about personal care, and all these other forms of care are essential and they are clearly time consuming. Okay, so turning to the study and the research that we've done, I should just start by explaining how we did this. So because unpaid care is an activity that doesn't result in a transfer of money, it's not part of economic measures like GDP. Full-time carers aren't deemed to be active in the labour market. And this means that the contribution of unpaid carers can often be overlooked and undervalued. And when we say economic value of unpaid care, I think, as Emma highlighted at the start, it's important to point out we're not trying to reduce the impact of unpaid care to a financial sum of money. We know it's life-changing and you can't really express its true measure in pounds and pence. But by putting it in economic terms, we can illustrate the kind of cost savings to the taxpayer that unpaid carers deliver, and it puts into context what they do, often unrecognised. So if someone works in the city for 15 hours a day, we can quantify the economic value of what they do quite easily because they're compensated for it. And you could say they earn a lot of money because they generate a lot of money for their firms. But if an unpaid carer spends 15 hours a day providing care to a loved one, that still clearly has a lot of value. And economists would like to capture that value. It's just a bit more complicated for us to do so because there isn't a transfer of money involved. So that's what we're trying to do in this research. So we sent a time-use diary to a sample of unpaid carers of adults with learning disabilities. We asked them to write in their own words what they did throughout half-hour intervals of as close to normal a day as possible. And that means how we can see how they're spending their time and what kind of support they're giving to the person that they're caring for. And then we can translate that into an economic value by taking two approaches. First, we estimated the attributable wage. So this is if unpaid carers were paid a living wage for all of the hours of care they provide, how much would they earn? So that's £9.50 an hour outside London is the standard living wage. And that's how much the living wage, if you don't know, it's the wage that you need to earn if you worked full-time hours to cover your basic costs of living. And the second thing we did was assign a replacement cost to all of the care that was provided. And this is it's the replacement cost of equivalent care if it were provided by the state rather than by unpaid carers. The replacement cost is a bit more complicated to calculate. So we used a very large study. It's called the Unit Costs of Health and Social Care 2020. It's compiled by academics at the University of Kent. It's funded by the Department of Health and Social Care down in Westminster. It's widely used by health economists because it breaks down the unit cost of various forms of care provision, and it's updated every year. And they base these costings on all sorts of data and information like financial returns from local government, NHS pay scales, care home fees, and so on. And the advantage of using this approach is that we get a breakdown of health and social care costs for different types of care provision. So we can then apply those different benchmark costs to the different types of care that we see in our time use diaries, rather than just multiplying hours of care by one average number. So for the value of personal care on its own, we've used the hourly cost of a paid carer as the replacement cost for the value of all caring activities in total, taking into account those other categories I spoke about. We've taken the cost of a supported living arrangement for someone with a learning disability, and that can be, or the cost of that can be flexed depending on the level of support need that an individual has in our sample. And then last point on the kind of boring methodology side is our sample size was quite low. So we had 18 participants in total. Obviously, unpaid carers are quite busy. And also the sample itself was self-selecting. And what that means is that our findings are illustrative, they're not representative. So we can't say all unpaid carers across all of Scotland save the government X million pounds per year. And that's why we present the figures and the results on an individual basis. On the other hand, this is the best evidence that we have in Scotland as far as we know. Our findings chime with everything else we've heard throughout this wider programme of work. So on to the results. So yeah, let's start with the hours of care provided. Just to point out, these figures are the hours of care that were provided on the day in question from our sample for those that lived with the person they care for. Just personal care alone was 2 to 8.5 hours, that's the range. And then if you add in all those other caring activities, it jumps up to from 8 to 16 hours. We know sometimes it goes even higher, but this was a kind of an average. Turning to the attributable wage, so this is if someone were paid a living wage for all of the care that they're providing. We can see pretty big numbers. So it's £35,000 a year if they were giving this personal care every day, is what the unpaid carer would earn. So these results are for each unpaid carer in our sample, not a total. And £78,000 a year for all of the care that's provided. And then the replacement cost, so this is what we think it would cost the government to provide an equivalent level of care. The total care is £114,000 a year for every person in our sample on average. It's higher, the replacement cost is higher than the attributable wage because you factor in other costs like overheads, not just the wages. Clearly, this is significant sums of money that we're talking about, and I guess it just demonstrates the contribution that unpaid carers are making. So we also asked our sample of unpaid carers about their household income to see if we can learn more about how the provision of unpaid care affects family finances. Using the information that we received back, we were able to estimate the household income and found that just over half of our sample were below or close to the poverty line, and just over half of all household income was in the form of social security income. Because learning disabilities are lifelong, the commitment that unpaid carers of adults with learning disabilities make has long-term limitations on their potential earnings and ability to work, ability to build a pension. And this, of course, limits the potential tax take from unpaid carers as well. So it has implications for the wider economy. All of those who were unable to work due to care commitments in our sample were women. And all of those who did have the opportunity to work relied on the support of family members or paid for carers. Taken all together, I think what we're seeing here is a loss of agency. So it's not just that our sample were financially worse off than average. It's also that unpaid carers of adults with learning disabilities are limited in how much they can work and earn over their lifetimes, limited in how much they can take on formal training, invest in their skills, and they're more reliant on the social security system. And without more help from society's system of support networks, like social care system, this will continue for much of their lives. We also asked about the well-being of our carers in our sample, and perhaps unsurprisingly, everything that we've spoken about feeds into lower wellbeing scores than the national average. So well-being is subjective to measure. So I should just explain the two measures that we used. So WEMWS, it stands for the Warwick Edinburgh Mental Wellbeing Scales. These were developed by academics at universities of Warwick and Edinburgh. It asks participants to score themselves on a series of positive statements about their mental state, such as I've been feeling useful, I've been feeling interested in other people. The average score for our sample was 40. I think it's out of 80, I think. But the most important thing is it's 40 for our sample, and that compares with an average in Scotland of 51.9. That's taken from the Scottish Health Survey in August, September last year, the most recent one that we have. Particularly low scores for the unpaid carers in our sample, and that really kind of stood out, were on the statements around loneliness, energy and burnout, and being optimistic about the future and feelings of self-worth. The second measure of well-being that we used is taken from the National Performance Framework. So this is where the Scottish Government sets out what kind of country they want to build and tells the public about what their priorities are. One such priority is to, quote, increase the well-being of people living in Scotland. And in the National Performance Framework, there are a range of indicators that we can track progress on, and some of them relate closely to measures of well-being. So we chose these measures because, well, they're an explicit aim of the Scottish Government, but also because they're nationally recognised formal priorities and they're quite easy to measure. One question was on loneliness. One was on the frequency of outdoor activities, and one was on satisfaction with the housing, your house or your flat. And on these three measures of well-being, our sample of unpaid carers were generally in line with national averages, except on the measure of loneliness that's on your screen. So 72% of our sample said they felt lonely some, most, almost all, or all of the time, compared with 20% of the general public in Scotland. So a lot of our sample wrote in their own words how providing unpaid care affects their well-being. So on top of what I've mentioned around exhaustion, social isolation, and loss of agency, another theme really stood out here, and that was that the well-being of the person that they care for is central to the well-being of the unpaid carer. So when we asked for their priorities for increased support, almost all of our sample of unpaid carers asked for not just more direct assistance for unpaid carers themselves, but for more services for adults with learning disabilities that would enable a greater degree of independence and a more rounded, fulfilling life for their loved one. So the last thing for me is on everything we've been going through over the last 18 months or so. We asked our sample of unpaid carers about their experiences during the pandemic. We know that many unpaid carers were already facing difficult circumstances before the pandemic, and so they were vulnerable to an adverse change in support that they receive. So we wanted to find out more about that and how that's worked in practice on the ground. So this is qualitative data that we have. It's people writing in their own words, but what I can do is kind of you pick out the common themes and what you hear a lot of. So, and two things stood out. A commonly reported phrase was a fight or a battle with the system that is supposed to support people with learning disabilities, unpaid carers and their families. Some respondents noted a sense of abandonment during the pandemic and a frustration at a sense that help only seems to be available when you reach a crisis point. And another theme that came out very strongly from the questionnaires was the impact on the person that they provide care for. Some respondents were transitioning their family member to a more independent form of living in preparation for a time when they won't be around to provide support. And we heard examples of progress to that aim being lost with, for example, people with learning disabilities losing skills that took a long time to develop. The implication is that there won't just be a return to normal for many families as we head towards, hopefully, life after the pandemic, or at least the peak of the pandemic. And also, as we begin to recover from COVID-19, it's, I think, reasonable to assume that the level of need is likely to increase, which will place more demand on unpaid carers and a social care system that's already under significant strain. No one in our sample has seen the level of support they receive return to pre-pandemic levels, and there doesn't appear to be a plan for this, even as Scotland moves beyond level 0, and many other aspects of our economy and our society have plans in place for reopening. And so all of this means that unpaid carers of adults with learning disabilities are facing an uncertain future. Oh, so that's it from me. So thank you for listening. The full report is available on our website. I think we'll share the link around towards the end. But yeah, so next up, I'm going to hand over to Pat and Jenny from PAMIS, who have far more expertise on this subject area than us. So yes, Jenny and Pat, if you want to share your screen and go for it.
Thanks very much, Rob. And I think Pat's going to do the technical aspect for me until I have to share my video, which will hopefully work. But yeah, it's I'm Jenny Miller, and I'm the Chief Executive of PAMIS, which is a fabulous job. But I have to say this webinar has really, really challenged me. I think partly because what you're telling us, Rob, you know, we have known and we've spent the last 18 months, I suppose, walking alongside family carers, and it's a pretty desperate picture, isn't it, really? So anyway, I have written down what I'm going to say in the hope that I then don't waffle on, but it's not been easy. It's certainly not been easy, and I think trying to think about, well, what are the solutions that we need to provide, and I mean, the families that we work with are always solution focused, and I think that's why I always really loved working here, but it's been very difficult to think about where we might go. And we're hugely grateful actually for your report, though, that was, and as I said, the evidence is we're all too aware of, but having it quantified alongside the research that's coming out of that 4 Nations UK COVID research on the impact of people with a learning disability and their family carers of those with a profound learning disability is really useful, and particularly as you highlighted in this current arena of change and revolution and hopefully things getting better. But it's also important because the group of people that we support, and they are children, young people and adults who have a profound learning and multiple disabilities, and their families appear to be invisible to many of the decision makers and within their own communities. Pat, do you want to pop up the next slide, please? We passionately believe that profound means deep and wise and expert, and we've been around for 29 years and sadly hearing similar messages still now here in 2021. But we as an organisation have always learnt from the experts, those people with a profound learning disability and their family carers, and I believe that they are the solution to a lot of the issues. They teach us how to care, how to act with compassion, how to really listen, and how to be creative and work as a team. However, profound learning and multiple complex disabilities, as was highlighted in your research, but I thought might be useful to really unpick, also means for many of our families a 24-hour caring role. As you've highlighted, family carers spend on average 8.5 hours a day on basic caring tasks. But when you add in all that indirect care, supervision to ensure safety, assisting with leisure activities, providing transport, ordering medications, sorting out your personal assistance, organising other aspects of care. And in our experience, unpaid care is also advocating and fighting for safe and meaningful lives. And I look around and see people that sit on some of the cross-party groups, making sure that this voice isn't hidden. But there's little time, isn't there, then for that genuine downtime. And we know that during this pandemic that this is intensified. So having a profound learning and multiple disabilities also may mean no independent mobility. It may mean postural difficulties, epilepsy, being doubly incontinent that requires a specialist facilities to have personal care needs met with dignity and respect. Sensory and sensory integration issues, communication which may challenge those supporting them, respiratory and nutritional difficulties, resulting in many of them being fed non-orally. There may be rare genetic conditions with complex care needs and challenges for services who may not be confident in the unique requirements. People with a profound learning and multiple disabilities are also more likely to require acute medical services, access to all the allied health professions, and a range of specialist services. Research tells us, as does our experience as an organisation, that this group will die earlier than the rest of us and of conditions that are preventable and treatable. The statistics for those entering hospital care and dying are a stark reminder as to why families become anxious about acute pathways into hospital care and the need for staff who know the individual to be able to accompany them and support them within the setting. It's difficult for people with PMLD to access activities in their communities because many facilities are not accessible or inclusive. However, we know that with the correct help, support and resources that are truly accessible, people with PMLD can and do take an active role as participants in their, sorry, I've just been signed out, cancel, in their lives. I'm hoping that doesn't mean I'm going to miss out on my wonderful little film in a minute. Can I have the next slide, please, Pat? A recent discussion with a group of families highlighted that this group, I mean, it was really stark in a third world situation. In 2021, our biggest ask for this group is to have a toilet facility that enables them to have their personal care needs met safely and with dignity. And in order to prevent a UTI, which may then take them into hospital, which because of the inability to take staff who know them into acute settings may lead to an avoidable death. Yet another task to add to the many tasks of family carers. Slide 3, please, Pat. So as highlighted in the report, the pandemic has further emphasised the inequalities for this group, and they and their carers are still suffering the impact. I heard last week we met with a group of family carers about limited or no day services, serious deterioration, physical and mental health, family carers being so exhausted and depressed, we've had an increase in the support required for those considering suicide, and a number have felt the only option open to them is to allow their relative to go into residential care. All of these experiences are being evidenced both through our work, through the report you've just read, but also in this COVID-19 Four Nations research. So I've really struggled to find the slant for this session because the current situation is really dire, traumatic, really tragic, and this group correctly feel abandoned, forgotten, invisible. Last night I interviewed a mum who suddenly can't come today due to other commitments, not least her caring one, and her story of what she does out with being a mum highlights the people within this report, and I thought it might be really useful to hear her voice, and I'm really hoping that this might work, although I'm a bit worried that I've just been cut out. So I think what I might do, Pat, is ask you to maybe talk about your slide, about which is another role of you as a carer, but with your usual solution focus, and then I'll see if I can re-log into my Zoom so that I can share the video. Is that okay, Pat?
Yeah, that's fine. I shall just carry on. So just to give a bit of context of what I'm about to say, I'm an unpaid carer, but my daughter lives in supported accommodation, so I don't have the day-to-day care of Lauren, but I'm hoping that what I'm going to say will give some indication of the interaction between paid and unpaid care, and how my kind of unpaid care is, and my well-being is adversely impacted on, even though Lauren doesn't actually live at home anymore. So my daughter Lauren is 33 and has a profound learning disability and complex epilepsy. She's non-verbal, doubly incontinent, and has little awareness of danger. She's on the autistic spectrum because of her communication difficulties. She is, however, very active and needs one-to-one supervision and company at all times. She lives in a housing support service with 3 others and visits the family home several times a week. And just by way of example, tonight my partner will take her out on adapted bikes for an outing, and tomorrow she'll come home for her music therapy online session. We found out in October 2018 from Lauren's staff that should she have to be admitted to hospital, it was social work's policy that paid carers for people with so-called special needs would not be funded when they were in hospital. The onus would fall to me as her mother, regardless of my circumstances, to provide any non-medical care that she would require. Furthermore, during the night, there's a very real possibility that she will have to be put in an ambulance and be left in A&E, accompanied by only a paper hospital passport. I've spent 3 years now trying to persuade the HSCP and the NHS that Lauren should be funded to be supported by her paid carers if she had to be admitted to hospital. It seems such a simple thing, really. She needs one-to-one support in her daily life, so why wouldn't she need at least the same level of support in hospital when she's ill or injured? It turned out to be not so simple at all, and it's been an arduous and distressing battle of attrition to persuade the HSCP, the NHS and the Ombudsman of the need for reasonable adjustment to be made. And I still haven't. So many of the challenges facing PMLD families could be resolved if there were clear hospital pathways, whether for outpatients, A&E, or planned or unplanned hospital admissions. Might it be possible that the high mortality rate for people with learning disabilities is the lack of clarity around how to access the right services at the right time? Much of the delay was put down to the pandemic, despite our argument that the pandemic made it more urgent for the situation to be resolved rather than less. So here's a photograph of Lauren in hospital when she had to be sent home, but should have been admitted for a week's observation, but social work wouldn't fund her paid carers and the NHS didn't have the capability. The black eye resulted from a seizure that threw her across the bathroom and smashed her head against a tiled wall. The outcomes for Lauren and others with learning disabilities could have been very much enhanced had there been an effective co-production between ourselves, other interested parties, the HSCP, the NHS and Lauren's care providers. However, our interactions with them were typified by delays in replying and sharing information, obfuscation, failure to consider the legal position, reluctance to answer reasonable questions, unwillingness to meet with us, and an esoteric and procrastinatory complaint system. Here are a few changes that could have made an enormous difference. Clear strategies and processes to help people with PMLD access hospital services, drawn up jointly by the HSCP and the NHS, following consultation with families, care providers and other interested parties. The person with a disability should be at the heart of the planning process. People with PMLD should be supported in a hospital setting by those who know and understand them, whether paid or unpaid. NHS staff should receive mandatory and meaningful training on learning disability. Learning disability and learning disability liaison nurses should have expanded roles, responsibilities and recognition. And there should be greater focus on the use of hospital passports, including digital passports. And it should be easier to access necessary information. In other words, people with PMLD should have the same rights as everyone else, with reasonable adjustments being considered and anticipated to ensure that that's the case. The most fundamental lesson that COVID has taught me is that there is no magic bullet, that we're not all in this together, and that no, the cavalry isn't coming. For our PMLD guys, where was the PPE, the testing, the vaccines, the services, the allied health professionals, the care home visits, the support for abandoned carers, the social workers, the outraged newspaper headlines? PAMIS is a very small charity that very much punches above its weight, but we were so grateful that they, at least, were there for us. We have to shout loud for ourselves and our children in the hope that someone, somewhere, is listening. And that's why I'm here today talking to you, because our best hope for the future is that people like yourselves will listen and hear us and become our cavalry. Mahatma Gandhi famously said, "The true measure of any society can be found in how it treats its most vulnerable members." What we need in our decision makers is a greater degree of empathy. My mum used to say when people stared at Lauren, "Walk a mile in my moccasins." And that's the kind of culture that we need. What if it was your child with the disability? What if it was your sister, your friend, someone you love or you care for? What if it was you? Wouldn't you like to think that the starting point in the decision-making process was the person with the disability. And how do we achieve all of this? Well, it's clear that solutions can be found, but they must include all of the interested parties, and especially those with disabilities. Then maybe, just maybe, together we can make those changes happen. Back to you, Jenny.
Thank you, Pat. And I found share my screen. Oh, this will stop you, but I'll do that. And we will hear from Carolyn, another powerful advocate like yourself, Pat. And hopefully this, oh, wait a minute. Oh, hang on a sec. I'm going to stop sharing because I didn't tick that little button that says also share. Oh, yeah, I did share the sound. Right, here we go.
So I'm obviously my mum. But the nursing part does come big into Freya's life for me. So I wish I could just be her mum. Freya's almost 12. She has significant health problems as well as disabilities. She has severe cerebral palsy and her airway is very compromised. She doesn't have a trachea, so really we're protecting her own airway all the time. She's 24/7 oxygen dependent. She's saturation monitored. We react. We don't react. We are very proactive with her airway care. So we have a really good chest physio program for her at all times, wherever she is. Freya goes to school, so she wasn't at school for 16 months during since the start of the pandemic, but she's went back, which is great. So my role in Freya's life is really, I call myself the care package manager, where I make all the decisions. I look after all the staff, albeit some of them are complex care staff from the NHS. I have my own staff, so I'm an employer. I recruit staff, I train staff, I make sure the care plan's up to date, liaising with the complex care sister and all the staff that look after Freya. I'm always the second nurse, so I have first nurses who come in and look after Freya, but I'm always the second nurse. Sometimes I have to be in the room all the time with Freya to look after her if she's having a bad airway day. I do all the ordering of the stock for Freya, all her medication. I liaise with social work constantly to do with care package problems, complex care sister. I liaise with all the clinicians. I am really, full-time job being Freya's care as well as looking after Freya. The actual coordination and collaborative stuff that I've got to do with everybody else is really there's a lot involved. Just making sure that Freya's well and kept safe all the time.
Yeah, wow, that is quite a care role. And Carolyn went on to tell us, if I can find it a little bit further on, about some of the solutions that she saw. But I mean, Carolyn, actually, I asked in another bit of the interview, I think I just will stop sharing my screen. I did ask her about how she learnt, what she does, and she's not nursing trained. I mean, she just learnt it all on the job. And one of the solutions that she felt was that she actually is part of the solutions. She and the family carers that work with her, because actually if we would accredit her learning and we would support her to look at developing that into a career pathway, then actually this shortage that we have currently of staff to provide the right empathetic care could be looked at and resolved. And it's certainly something that will be feeding into that national care review, particularly around the workforce. I mean, the skills that she's being asked to carry out are, I mean, I have heard that a number of times, but last night when she was telling me, I mean, the best time to get her was 9 o'clock at night. And what she was telling me, I just couldn't really believe about, but just about how extensive it was, I suppose. So she also, along with Pat and many other family carers that we work with, Pat, if you can share screen. Also support PAMIS to deliver to other family carers. And during lockdown, there was a wee group of family carers that looked at developing a national Scottish pastoral care strategy. And this was a group of families who have intensive roles, like Carolyn, who still found the time to meet on Zoom regularly to contribute to a strategy. So that was co-written and then launched earlier this year. And they have also been developing training sessions on pastoral care, telling their stories, co-delivering the education, and have been developed as co-trainers. PAMIS are very proud to say that we're able to fund, thank you to the Alliance who have funded this project, but we are able to pay for that contribution. And I think there are a number of families who would really love to find a route back into employment. And I think we spoke with Rob last week about just considering what impact that has actually on family carers being able to contribute back to their tax back into a social economy. But this group, you know, with all of those tasks that they have underneath, are still able to tell their stories, share their experience, and train other people in the protection of body shape, which I have to say escalated at the beginning of COVID, because suddenly everybody realized that posture really matters when you've got respiratory illnesses. So yeah, this is a major piece of work. But Pat, do you want to go to the next slide? So that was our positive impact, I suppose, on the fact that these families, carers who still have these extensive roles, still find the energy somewhere to be able to contribute. But it is still a pretty depressing picture. And I guess I don't know, Emma, whether you had questions, but one of the things I thought it'd be really useful to open up into discussion is what do we all need to do together to change the situation that we're in, to value, because one of the other things Carolyn said later on in the interview was that she felt really undervalued, that all of this input that she has, she felt wasn't appreciated and was taken for granted, and she just wanted people to appreciate what she did, really. Although she did say the payment that she had was Freya's smile, which is a lovely way to end, isn't it? But Rob, I'll shut up now, and it'd be really great to have a conversation, wouldn't it, with others to find out where we might go.
Thanks very much. That was fantastic, and really hard to hear some of it, but really illuminating. So thank you.